Moving on to our next speaker, he is Dr. VIJAY MOHAN KOHLI. He's a senior cardiac surgeon with 45 years of experience in adult cardiac surgery and has performed close to 10,000 heart cardiac operations. He's working as a senior consultant at Fortis Memorial Research Institute in Gurgaon and Pushpawati Singhania Hospital in New Delhi as well. His interest has, as a cardiac surgeon, he was drawn to the ancient Indian complementary systems of medicine and took courses in Ayurveda, naturopathy, energy medicine, acupressure, and yoga, and delved deep into spirituality. Since spirituality is the root of all the above mentioned modalities of treatment, Dr. Kohli has conducted a number of panel discussions on various health issues and diseases with the focus of holistic methods of healing. His topic for today is sodium paradox. Let us understand from the man who has, the doctor who has done a lot of his career along the same path. Let us understand from him. Over to you, sir.
Namaste. Thank you very much, Dr. Karishma, and I am so thankful to IAFM and especially to Dr. Ashwini for having invited me to speak on this topic, which interesting, no doubt, but not all that easy to describe. I'll do my best. I'm also thankful to Dr. Shottam for his help. Now, what exactly is the sodium paradox? You see, for the past few decades, we've been told that sodium or salt should be restricted, especially in those who have hypertension. But let me tell you, this is a myth and should be taken with just a grain of salt. And therefore, it is important to discuss sodium, what it does in the body, what happens if you don't have enough sodium, so on and so forth. Now, I really love this expression. We are essentially salty people. We cry salt, we sweat salt, and the cells in our body are bathed in salty fluids. Without salt, we would not be able to live, and I truly believe in this. I'll also quote Paracelsus. Hundreds of years back, he mentioned that the human being must have salt. He cannot live without salt. Without salt, nothing will remain. It will all rot. In this context, I would like to mention about the sad demise of Sri Devi. Boni Kapoor is supposed to have told the Indian Express that she died because she had restricted her salt intake to almost nil, which was the reason for her death. So you can understand how important salt is. Now, when we talk of salt, we have been consuming salt since time immemorial, and therefore it used to be called white gold once upon a time. The Roman Empire paid its soldiers with salt, and that is how the word salary comes into being, which is quite interesting. So also the word salad means salty greens. So you can understand how important it is. Now, this natural salt is important because it has all the minerals and trace elements, all of which are essential. Our bodies are designed to manage sodium chloride in combination with trace elements. It is as important to us as water is for thirst. Now, this myth started in the late 1800s when some scientists felt that restricting salt was the answer to a lot of problems, especially for edema. Then also Strauss in 1904 felt that he started a diet for treating edema by reducing salt. Then came the very important study, the salt blood pressure hypothesis in 1904, which simply said that if you consume salt, then your thirst increased. And when your thirst increased, you tended to accumulate water, and this water led to hypertension as well as other cardiovascular problems. Again, in 1944, Walter Kempner, he started his rice diet, and again, he was promoting a low-salt diet for all patients, especially hypertensives. This war continued. In 1950s, Louis Dahl, he developed a strain of salt-sensitive rats who routinely developed hypertension. Then came along the InterSalt study of 10,000 subjects over 52 centers in the world. But unfortunately, the authors neglected to mention that the population of the 4 countries responsible, we screwed up their data, had less obesity, ate far less processed food, had more fiber, fruits and vegetables in their diet, and they also died younger, so there was not enough time for them to develop atherosclerosis. This study was also found to be subsequently flawed. So early studies had not been conducted very well, but unfortunately, we are still basing our treatment on that, especially in mainstream medicine. Now, with salt restriction, there have been a number of studies showing that if you restrict salt, the incidence of heart attacks increases. Now, Dr. Alderman, he published his data on 3,000 hypertensive patients and found that the results indicated a 430% increase in heart attacks in the group with the lowest salt intake. Now, this is so because when you take low sodium in your diet, then there are multiple nutrient deficiencies, especially minerals like calcium, magnesium, potassium, etc. This has been published by Dr. David Brownstein in his very nice book called Salt Away to Health. And Alderman also reported that the more salt you eat, the less likely you are to die from heart disease or anything else. Now, also Dr. Robert Heaney, he states that the ultimate physiological purpose of sodium intake is precisely the maintenance of blood pressure. Now, this is just totally contradictory to what we have been led to believe. Now, what happens when you reduce your salt intake? There's a tremendous load on the kidneys. This leads to other problems. There have been many studies to show that high sodium and low, they have correlated high sodium intake with low cardiovascular mortality. Now, especially the NHANES study, where 20,000 subjects were studied over 20 years, and they found that a high intake of salt was commensurate with the lowest cardiovascular disease and other all-cause mortality. Similarly, another study published by W.C.S. Smith, they studied 7,300 Scottish men and studied their urinary sodium, and they came to the conclusion that salt has got nothing to do with hypertension. Now, when you restrict your salt a lot, blood pressure rises for various reasons because of aldosterone, arteries become more constricted, etc. Now, when I say I'm taking sodium and salt together, for the very simple reason that sodium alone, as I've already mentioned before, has to work in cohesion with the other minerals also. So let us go into the genesis of salt. Now, salt, sea, and us, we have a very strong relationship. Our physical inner world actually came out from the sea, and we carry a lot of saltiness inside us intuitively. NaCl, which is a very important constituent of seawater, is also an important constituent of our blood, along with the minerals which are very similar in quantity to that in seawater. At this point, I must point out that minerals and their interconnectedness. Now, as in nature, everything is interconnected. Everything is complementing each other. So by merely studying one mineral may not be enough, because deficiency of one mineral may have a cascading effect leading to other problems in the body. I'll come to this a little later again. Now, we also need to remember the basic principle of nature being balance, which is the essence of nature. All minerals, vitamins, in fact, everything in our body as well as in nature needs to be in a state of balance. And these minerals also are important. Why I'm saying this is that merely, getting a sodium level may not alone be enough, because the ratio of the sodium and potassium is much more important, as it gives us much more information. I'll take that later. Now, why is salt important? It is important for maintaining optimal amount of blood in our bodies. If it is inadequate, our blood volume can go down, which can have a detrimental effect on the kidneys and other organs as well, like the brain. It is essential for digestion, cell-to-cell communication, bone formation, our strength, and also for prevention of dehydration. Sodium is critical for reproduction, proper functioning of cells, muscles, and optimal transmission of nerve impulses from to and to other organs. It is important for proper concentration of sodium, potassium, magnesium, calcium. It is also supposed to play a very important role as a buffer in the effects of stress. Decreased salt intake may cause a lot of anxiety, mental challenges. Increased anxiety and salt restriction can also lead to sugar craving, surprisingly. So if one is craving sugar, one of the reasons could be that one is deficient in salt. Now, when sodium plays a very important role in the sodium-potassium membrane electrical potential. So this moves sodium out of the cells and potassium into the cells, as we are all aware. It is because the negative charge inside the cell. Now, whenever there is a disturbance of this mechanism, it affects the entire body in some way or the other, because this particular pump is responsible for the movement of other minerals as well as amino acids into and outside the cells. Also, sodium chloride is important for the production of hydrochloric acid. So if sodium chloride is deficient or salt is deficient in our bodies, we do not produce enough hydrochloric acid. When that happens, that leads to heartburn, digestive disorders, etc. And also, if there is inadequate hydrochloric acid, as you can understand, protein digestion and production of amino acids suffers. That further leads to problems like deficiency in neurotransmitters and things like that. Entry of essential amino acids, as I already mentioned, suffers. Also, sodium regulates calcium homeostasis. So when there's less sodium, calcium homeostasis suffers. Because of that, the heart can also suffer, and there can be detrimental effects on the heart. So because of this, intracellular potassium levels decline rapidly. Thyroid hormone resistance may occur. Starvation of all cells occurs. This also leads to a relative magnesium deficiency, because calcium seeks more magnesium. A relative magnesium deficiency leads to problems with the adrenal gland. Adrenal dysfunction may set in. So ultimately what happens is that low salt or low sodium can lead to heart disease, hypertension, obesity, type 2 diabetes, depression, hypothyroidism, dementia, so on and so forth. Now, adrenal malfunction can have long-reaching emotional consequences, including anxiety, withdrawal, and indecision, and physical ones, including increasing numbers and severity of infections, more frequent viral illnesses, and increase in cancer risk as well. So this too is important. Now, coming to the common symptoms of sodium deficiency, the commonest symptom is weakness and fatigue. This we see very commonly in our patients, and very often we do not attribute it to sodium deficiency but to other factors. Now, this is because sodium also plays an important role in mitochondrial function as well. So mitochondrial function goes down, because of which we have weakness and fatigue. It can lead to irritability, headaches, twitching, spasms, cramps, muscle weakness, forgetfulness, brain fog, confusion, and ultimately hyponatremia, if it gets severe, can lead to low blood pressure, leading to unconsciousness and even death. Now, there are two important hormones which are good for salt regulation. One is cortisol, which is a salt releaser, and the other is aldosterone, which is a salt storer. Now, sodium also plays a very important relationship with water, because osmoregulation is important, and both of these go virtually hand in hand. Now, chronic salt depletion leads to a panic in the body. As a defense mechanism, the body increases insulin, because insulin helps the kidneys to retain more sodium. This locks energy into the fat cells. The only fuel left are carbohydrates, and your body starts craving sugar and refined carbs. Increased intake of these leads to insulin resistance and eventually type 2 diabetes. Now, the question then arises is, how much salt should we consume? Now, I'd like to mention that healthy people need not worry about this at all, because if you ever take an increased quantity of salt, then the kidney will just excrete it out of the body. So nothing to worry about. Salt should be taken to taste. But the World Health Organization recommends 3 to 6 grams per day. But this, I think, should be ignored, because WHO guidelines do not take into account the humidity level, the body mass level, the function of the sweat glands, and the functioning of the lymphatic system, etc. So there's a lot of variation in this, and this should not be taken very seriously. Also, it is important to remember that there are three very important medical conditions where one needs to limit sodium intake, and that is hyperaldosteronism, Cushing disease, and also Little syndrome. But we need more salt in certain other conditions. For example, whenever you are over consuming sugar, then your salt intake has to be higher also. If you have chronic diseases, especially like hypothyroidism, if you have adrenal insufficiency, if you have congestive heart failure, surprisingly, most cardiologists restrict sodium in congestive heart failure, but this is again contrary to their views. There are a few commonly prescribed medicines which increase the need for sodium in the body. For example, diuretics, antipsychotics, SSRIs, certain diabetes medications, and also caffeinated drinks, coffee, tea, etc. If you are doing intense exercise, you need to increase your salt intake, which is common sense. If you are having a low carb diet, if you're on intermittent fasting, if you're doing a keto diet, in all of these conditions, the intake of sodium should be increased because the body needs more sodium. In fact, one of the reasons why people have this keto flu and headaches and all that is mainly because of low salt. Because when you're doing these type of diets, then you're excreting a lot of fluid and a lot of electrolytes, especially sodium and potassium. So to compensate for that, when you're starting intermittent fasting, as I generally recommend my patients to, I ask them to have a quarter teaspoonful of salt, that is pink salt, in a glass of water morning and evening to take care of this. So I'd like to just remind you of this saying, when you crave salt, remember that's a salt thermostat speaking to you. It is telling you that your body needs more salt and therefore you should increase the intake. Now there are types of, many types of salt, and this is quite interesting because when we talk of salt, then there's a lot of confusion going on. What we do not recommend is refined salt or table salt, because it contains about 39% sodium, 60% chloride, which is all right, but it does not have any minerals. On the contrary, it has some ferrocyanide, aluminum silicate, ammonium citrate, it has dextrose up to 2%, and iodine, small quantity of iodine, I'll come to that a little later. It may contain microplastics. It reduces the body's ability to detoxify. It also exacerbates the toxicity of bromine. Now, refined salt contains iodine, but this iodine is not completely bioavailable to the body. Now, a lot of people, in fact, world over, all lay people and doctors believe that this level of iodine is very important for the body, but I would like to remind you that this level of iodine is it is chemical iodine. Only 10% of this is absorbed in the body. And this iodine is just sufficient to prevent goiter formation. But iodine and potassium iodide are very important for every single cell of the body, which means you will still have deficiency of these salts, these iodine and iodide salts in your body. Therefore, iodine then needs to be supplemented in some form. Unrefined salt can be of a number of types. One is the Celtic salt, which I don't know if it is really available in our country. It has 33% sodium. It has 50.9% of chloride. It has 1.8% of minerals and trace elements. It has 14.3% moisture because this comes directly from the sea. While pink salt, on the other hand, has about 96 to 99% of sodium chloride. It has 84 trace elements, plus calcium, iron, zinc, nitrogen, hydrogen, etc. But it has very little iodine or iodide. There are certain more differences. Now, refined salt can lead to acid-base disturbances and ultimately may lead to chronic disease like cancer, autoimmune problems, arthritis, and may accelerate aging. While unrefined salt, on the other hand, as I mentioned before, makes hydrochloric acid in the stomach, is important for the adrenal glands, is needed by the immune system, helps against insulin resistance, helps in hydration, and required for the proper functioning of the sodium-potassium pump, which is required for the muscles and nerves. Now we talk of Sena salt because that is very commonly eaten in our country. This comes from the sea also. It has a number of trace minerals. This is quite good. It is very similar to pink Himalayan salt. There's something known as Kala Namak or black Himalayan salt, which is actually volcanic rock salt found in areas of the Himalayas and northern India. Contains sodium chloride and
Just a
sulfuric
reminder.
compounds.
Sorry for the interruption. Just a reminder, 5 minutes to go.
Yeah, thank you. Thank you. It is also made, it is also used by Ayurvedic physicians. At this point, I would like to mention that I've been promoting pink salt, but a couple of days back, there was a discussion on that. And a few people mentioned, and which was quite relevant also, that pink salt is being, now they find that it could be having some heavy metals and things like that in it. So Dr. Naveen, I'm thankful to him for that. He sent us a link. If you go on the link, you can, follow that link and understand how to check for that type of salt. And also, from experience, I can tell you that if you dissolve pink salt in water, if the color remains pink, then that means that there's some problem with that salt. But if it remains colorless, then more or less it should be all right. Black salt has many benefits. It is digestive, it smooths the muscle spasms, has no blood thinning, etc. Now, those people who feel that refined salt, if you take refined salt, you're getting enough iodine, which actually you are not. So you can supplement iodine from various food sources like asparagus, garlic, kelp, lima beans, etc. But a point to remember here is that when seafood has a lot of iodine, but this seafood could also be having mercury. So we need to be very careful about that. And therefore, I strongly feel that iodine should be supplemented because I am of the view that most of us are deficient in iodine and we need to supplement that. Now, I had mentioned something about the importance of the mineral ratios, especially about sodium and potassium ratios. And this we can get from an HTMA analysis, and that gives us a very good index because a low sodium potassium ratio may indicate an impairment of the nerve mechanism, chronic stress of the liver and the kidneys. It's an index of carbohydrate intolerance indicator for other things. So this, I think, a blood level may not always tell you the right idea, may not give you the right idea. So mineral ratios are important. So to conclude, salt is essential for health, just as drinking water is. Deficiency of salt in the body causes weakness, headaches, irritability, forgetfulness. Consumption of sodium or salt must not be restricted. Adequate quantity of natural salt needs to be consumed. Pink Himalayan salt, Celtic salt, Redmond salt is another very good salt which is available in the US. It comes from an ancient sea. It also has a certain amount of iodine in it, and the ratio of the minerals are important. So finally, I feel no physician worth his salt can afford to ignore salt. Thank you so very much. I'm so thankful to IAFM and all of you for giving me this opportunity.
Thank you so much, sir, for providing your insights on types of salts and what needs to be used. There's just one question that needs to be asked. How should salt be taken when we are talking about the rock and the Himalayan salt? What is your take that is it best to that it should be used in cooking or should be used in raw form on the salads? Which is the best form that it should be used is the question.
I think both in cooking, and if you're fasting, then you have to supplement it, as I mentioned, taking it in a glass of water. Because I also mentioned, if you remember, that salt should be taken to taste.
Taste, yes.
There's no fixed quantity for that. Yes. If you have no problem with your kidneys and all that, then the kidneys will just excrete excess out.
Yes.
And even if you have, I'm sorry, even if you have a kidney problem, then also you should not restrict it. Take just a normal quantity of salt. Thank you.
Any ideas or any light that you can throw on this topic? Fermenting salt.
That's what I mentioned about that link that Dr. Naveen sent yesterday. Yes. That he ferments it, and by fermenting it, he gets all the excess metals and contaminants out, and then that salt can be used, if you have any doubts about that.
Yes, so we have answered all the questions, though there were only 2 questions only. And you have already mentioned on the relation of the salt with the thyroid and chronic conditions as well. It was well discussed in his presentation only. So we'll be sharing the recording if you have missed it. Thank you so much, sir, for joining us. And you can stay back if you have any questions in the chat box. Thank you so much for
Sure.
joining.
Thank you. Thank you very much.
Thank you so much.